sure why this belongs here, but obviously there are all kinds of infections. There are viral and bacteria, and for some reason this wants to put HIV/AIDS as a third category, but that's a virus, so why is it just not viral? Okay. Infections in the brain are usually not easily diagnosed by the usual means that practitioners diagnose things. So if I want to find an infection, if I'm looking for someone who's got a fever and I want to know if they have an infection, what's the first thing I order? Blood work. What blood work? CBC, complete blood count. I'm going to see an elevation of white cells. Why does that not happen with a brain infection? Blood-brain barrier, that's right. So if an infection is on the brain side of the blood-brain barrier, it will not stimulate white cells. Where will the white cells show up? CSF, that's right. So what do you need to do to find an infection in the brain? A spinal tap. Okay, do we routinely do spinal taps on people that have fevers? No. So that's why it's a difficult disease to diagnose. And I'll share with you all, the only malpractice suit I've ever had was for the death of a 2-month-old child from meningococcal meningitis. And when he came to me, he was perfectly normal. And 12 hours later, he was dead. And that's a disease that the #1 reason for lawsuits, for malpractice suits in the United States is meningitis, because it's that difficult to diagnose, and it's that rapidly fatal. So here I had a perfectly normal 2-month-old cooing at me, complete exam, documented on paper, no abnormalities. Mom brought him in because he had a fever the night before. He was afebrile when I saw him, and 12 hours later he was dead. Mom was 16 and paid absolutely no attention to his rapidly progressive symptoms. Okay, so the mechanism of spread to the CNS can be hematogenous, so an organism that can cross the blood-brain barrier through septic emboli, through the pulmonary veins, and through cardiac valves, right to left shunts. Now, why do you have to have a right to left shunt for it to go to the brain? The right side of the heart's collecting what? Venous blood. The left side is arterial. So, if you don't have a right to left shunt, the lung acts as a filter. So it goes through the pulmonary system. It won't make it to the brain because it's going to end up somewhere in the lungs. All right? But if you have a right to left shunt, the right atrium shunts to the left atrium, which pumps it out through the left ventricle and sends it up through the carotids to the brain. The most common right to left shunt is a patent foramen valve. Foramen valve is supposed to close at birth. In some people it doesn't. They have an open foramen valve, and right-sided blood gets mixed with left-sided blood. It usually doesn't cause a problem, except in this case, and one other that's one of my favorite areas, and that's in scuba diving. You can have an air embolus if you have a PFO, patent foramen valve, because nitrogen bubbles can pass from the venous side to the arterial side. Usually find out when somebody comes up with vents, with the brain vents, and put them in a chamber that goes wet. Okay, you can get extension from the sinuses. So if somebody's got pus running out of their nose, you better do something about it pretty quick, because that epithelial plate's very thin, and those organisms can make it through to the brain. So that's one area you've got to worry about. They can come from the mastoids from the ears and from the middle ear. So, and of course, if I stick a crowbar in your head, that might do it too. Okay, and here's that word, iatrogenic. All right, so iatrogenic could be through surgery or through some shunts. An individual with hydrocephalus has a shunt that they run from the brain to dump extra fluid out, usually into the abdomen and or into thoracic areas Even blowing your nose real hard can cause you to have a brain infection. If you blow your nose hard enough, you force bacteria backwards up through the eustachian tube, get a nice middle ear infection, and end up with a brain abscess. Okay, types of bacterial infections. Meningitis is the most common. Most common organism is meningococcal meningitis. Meningococcal is also pneumococcal. It's the same organism. It's strep pneumoniae. And that's the most common cause of meningitis. Second cause is viral. The third cause is aseptic meningitis. We don't know what that's due to. Inflammatory response in the meninges without an infective source. Okay, brain abscess could be from various things. AIDS patients often get cryptococcus meningitis. Cryptococcus is a fungus, and that fungus forms a little ball in the brain. That's pretty nasty. Tuberculosis, tuberculosis could be in any organ in the body, including the brain. Neurosyphilis, I don't know that we see very much neurosyphilis anymore, but the spirochete can cross the blood-brain barrier. And the other spirochete that we now know of is Lyme disease, which also has a tertiary phase and can cause brain damage. So Lyme disease is not caught in the rash phase. It goes into a latent phase, and during that time it can enter the brain. Okay, this, let's see. We've got the different causal organisms for the different ages. Newborns, it's usually streptococcus. It could be E. coli in anybody. Listeria is kind of rare, but it's still around. Strep pneumoniae in infants and children, followed by Neisseria vaginatus, that's a secondary Neisseria infection from mom during birth. Neisseria being, what's Neisseria the genus for? Gonorrhea. Neisseria gonorrhoeae, and Haemophilus influenzae, which is common to middle ear infections in children cause brain infection. Neisseria meningitis is actually it says the leading cause in adults. I doubt that. I think it's probably strep pneumoniae. Most of us now treat gonorrhea pretty early, so it usually doesn't make it to the brain. And then in older adults, it's strep pneumoniae. So the organism we really have to remember is strep. That means a strep throat can be fatal because that's strep pneumoniae. If it ends up crossing the blood-brain barrier, you end up with a brain abscess. So that's why we're pretty aggressive about strep throat. Okay, this is bacterial meningitis in an infant, and those are purpura on the body. That's as a result of streptococcus. The CSF shows an increase in protein, a decrease in glucose because the organisms are feeding on the glucose. Treatment antibiotics is, I'm sorry, I didn't make these slides, but I want to tell you that meningococcal meningitis is fatal in about 85% of the cases, no matter what you give them, even if you get it early. And you don't usually get it early because they don't show symptoms till they're dying. But the primary symptom is purpura. If the baby breaks out in purpura like this, they have meningitis. Brain abscesses, I'm going to show you a picture of it. It's amazing how these can grow. They could be anaerobic streptococcal strains, gram-negative rods, that's E. coli or Proteus, or our friend MRSA, Staph aureus. Most of them come from the paranasal sinuses. You can have a chronic lung infection called an empyema. It can also end up in the brain. And you can have hematogenous spread through the heart valves and the pelvic organs in PID. That's why Neisseria PID is dangerous, because you end up in the brain. Okay, it's a ring-enhancing lesion, which means you see the lesion, but you also see a black ring around it. The treatment for all abscesses anywhere in the body is drainage, drainage, drainage. All right, you can throw antibiotics at it till the cow comes home. If you don't drain the lesion, it doesn't get better anywhere in the body. So if you see someone with a MRSA infection, and you'll see a lot of those because they're working out in PT, you gotta be careful that they don't spread disease on the mats and everything else. But you'll see lesions on their arms and their legs. It looks like a spider bite. People come in and say, I have a spider bite in the ER. It's not a spider bite, it's MRSA, methicillin-resistant Staph aureus. And it needs to be treated, or you could end up with death. That's a MRSA infection in the brain. That one I don't have to point out with a pointer to you. That's pretty obvious. That one's in the right frontal lobe, which I imagine gave the person a lot of difficulty if it didn't kill them. Tuberculosis meningitis is from Mycobacterium tuberculosis. The test for it's a PPD, purified protein derivative, test in the arm. All of you will get those many times during your career, because if you work in a hospital environment, they want you to have the PPD. Interestingly, the CDC put this out this week, so this is brand new information. If you have a skin conversion PPD, you get a chest x-ray to prove you don't have tuberculosis. You don't need a chest x-ray every year. Unless you show symptoms of TB, that is you have a cough or night sweats, you never need to be tested again. Don't do another skin test, because that'll be grossly positive, and you can actually lose enough skin to need a graft. And you don't need another chest x-ray. You fill out this questionnaire, says, I don't have these symptoms, you're done. That's being passed on to JACO, and when you guys go into practice, if you're a positive skin cancer, you'll get one chest x-ray for your career, and that's it. We'll keep a copy of the report, that's all you need. This is brand new. Tuberculosis is not gone from our population. It's still found in inner cities quite a bit. I have a positive skin test because why? I trained in New York. And half the patients in New York have TB. These are the signs of it. There should be a tubercle somewhere in the brain that you'll pick up on scan. They have headaches, the usual things, headaches, confusion, fever, and the CSF will have about 200 cells in the range. There'll be increased protein, decreased glucose. Yeah.
So on the skin test, what are you looking for after you get that?
Skin test is done intradermally on the inner forearm. They raise a little wheel, and then they read it 2 days later. If your body reacts to the wheel by becoming more than 10 millimeters in diameter, then that's a positive skin test. Then you need an x-ray with lordotic views, because the lesions are up at the top of the lungs. So they shoot the x-ray this way, and you can look at the x-ray and see that there are lesions. If they're cavitating lesions, that means they look like cysts. They have a wall and everything. That's tuberculosis, active tuberculosis. If there are no lesions on x-ray, and you're a new skin converter, then there's a protocol followed by the CDC for you to take meds for 6 months to make sure you don't have active tuberculosis. All right, as a new converter. Once you've done that, have a clear chest x-ray, you no longer need to be treated. There was some brouhaha a few years ago about a guy got on an airplane and was a positive skin converter, and he misunderstood the whole disease, and people were saying he had active tuberculosis aviary, the one that kills, and the guy got pulled off the plane and arrested. It was all big misunderstanding. It wasn't. None of it was based on science. It was all panic. Gesundheit. All right, neurosyphilis is found so rarely in our society nowadays. We still do RPRs to test for syphilis on marriage. Don't know why. I would think HIV would be more appropriate, but you still do RPRs. You have to have an RPR to get a marriage license. And so they're still looking for syphilis, but it's kind of a rare disease in our society nowadays. And syphilis is called the great imitator. It looks like about every other disease you've ever heard of. Very hard to diagnose. The lesions that appear look like the same lesions you get with Lyme disease. And they're fleeting. They only last a couple of days, 3 days, 4 days, and they're gone. In syphilis, they call it secondary Louis. I don't know why, but it's a whole body rash. And it doesn't spare the palms of the hands and the soles of the feet. You see a lesion in the palms of the hands and the soles of the feet. It's either syphilis or it's hand, foot, and mouth disease, which is a virus. Okay, there's Lyme disease. I'm going to show you a picture of the tick. It's not very big. They come from deer ticks. Most common place that I know of for deer ticks is central Pennsylvania, where I grew up. I grew up in Bucks County, Pennsylvania. Lots of deer. So, but also there are deer leases in Texas. And Lyme disease does exist in, I think, all 50 states. Yeah.
I'm from Virginia, and we vaccinate our pets against Lyme disease, and they won't do it here. So
No,
I think it's less prevalent here.
And it's found in Texas. It's
Yeah.
just, each state has their own rules about how to protect people against disease. You can't screen for everything, get treated for everything. If they did, you look like a pincushion from all the vaccinations. So each state has to say, well, that's not prevalent here, or it is prevalent here. And this is a particularly bad organism, and that can cause encephalopathies that don't go away or permanent. Back pain, vertigo, facial palsy, bladder problems, awkward gait, weakness in the legs, cognitive impairment, just like syphilis. It's a spirochete. It's this similar organism. That's what they look like. So you think you'd notice a deer tick that size? Probably not. People pull off these big ticks. Those are not deer ticks. But this is what a deer tick looks like. They're pretty small. Nasty little bug. How do you get a tick off somebody's skin, Burn them off?
Nail polish.
Nail polish. I like the nail polish. Yeah, don't burn them off. You might believe the mouth parts behind. They breathe through their skin. They're arthropods. So if you want to suffocate them, if you put a drop of mineral oil on them, they're going to back out pretty quick because they can't breathe. Right? Arthropods breathe through, remember biology? Arthropods breathe through, they breathe through their skin. You have open circulatory systems. Yeah. I have a master's in ecology, so I probably know that. I have no use for it anymore. Okay, it talks about encephalopathies, from various viruses, especially the arbovirus. Shingles, varicella zoster, can end up in the brain too. Can end up in the ophthalmic division of the eye. Those are bad shingles infections. You have shingles in your eye. The problem is most people, if you go to a doctor, what do they want to give you for your eye infection? The steroids, yeah. Does shingles like steroids? What do you think? Think the herpes virus eats steroids? Yeah. If you put eye drops into a person who has shingles, that's another reason for malpractice suit, usually among ophthalmologists, because they don't recognize it as shingles. They give them steroidal eye drops, and they end up blind. And then there's AIDS. Boy, I like that one slide on AIDS. All right, well, as you know, AIDS ends up everywhere and can do just about everything. If they call syphilis the great imitator, certainly AIDS is as well, and also has neurosyndromes as well. They end up in the localized to the thoracolumbar spine, and can be confused with B12 deficiency. So again, remember what I said this is the last slide, so I'll just bring this point out again. In the real world, you just don't have, oh, this is neuroscience, So this must be a neurological disease. Now, this is a human being who could have anything. So if you suspect, and you guys will sometimes see it before the doctor would, because the doctor sends in the PT because they're ataxic, and it turns out they got a brain tumor. And he hasn't worked it up, because the average family practitioner in a rural setting does not have an MRI readily available to him. So he's going to do a physical exam, say, you know, I think you have Meniere's disease, you're ataxic. Let's send you to a PT for some physical training. And you guys get them, and you may say, hey, this doesn't look like Meniere's disease, something else is going on. That won't be too long from now when you're all clinicians. Like I said, I want all your cards at graduation, so I know who to refer to. All right, that's it for today. Questions? No questions? Wow. Maybe you did a great job, or you didn't understand a word. All right, nice seeing you guys again. I'll be back next month for another lecture.
Thank you.